But thanks for starting the recording. Okay, well, let's get started. Hi, everyone, to our wonderful attendees who made time for this little lunch and learn today. Thank you for attending the second session of CANE's new sustainability webinar series. My name is Ashley, and I'm joining you today from the unceded traditional territories of the Squamish, Musqueam, Tsleil-Waututh, and Coquitlam peoples, otherwise known as Burnaby, British Columbia. Before we begin, we want to start in a good way and acknowledge that all of us who work and live on Turtle Island, or so-called Canada, are on the traditional territories of the many First Nations, Métis, and Inuit peoples who inhabit and continue to care for these lands. We honor their rich cultural heritage, traditions, and stewardship of this land. We recognize the enduring connection that Indigenous peoples have to this land, and we commit to fostering respectful and positive relationships, not only with one another, but also with the land itself. We make this acknowledgement with the recognition that nurses have a responsibility to learn the devastating impact that colonization has had on Indigenous peoples past and present. We recognize our duty to respond to the calls to action of the Truth and Reconciliation Commission of Canada. So on behalf of the Canadian Association of Nurses for the Environment, or CANE, we would like to welcome you to our webinar series called Evolving Healthcare, Pathways to Sustainability and Planetary Health, which is scheduled to run about monthly or every other month from January to April 2026. This series was created through a collaboration between the Sustainability Committee and the Education Committee at CANE. And we aim to convene leading experts to explore the critical intersection of healthcare, environmental sustainability, and planetary well-being. So over the next few months, the webinar series will delve into various facets of sustainable healthcare, including the environmental impact of healthcare, climate-resilient health systems, greening medical supply chains, health equity, and policy frameworks promoting planetary health. Our goal is to foster a dynamic exchange of ideas, share best practices, and inspire actionable strategies for a healthier planet and healthier populations. Through the series, we are striving to build a connected community of professionals, healthcare professionals, researchers, and students from around the world. On the technology and housekeeping side of things, we will be recording this session today. You likely all got a prompt, and posting the video on our website, on CANE's website, later for those who are unable to attend the session live. If you would like captions right now, you can click on the captions button at the bottom of the Zoom screen. On that note, are you seeing my captions as they come up, or is that not being shared? Great. We would also like to ask you to please use the Q&A button at the bottom for any questions you would like to ask our wonderful speakers. Please don't post questions in the chat, as that won't be monitored, but we do encourage you to use the chat right now to let us know where you are tuning in from today. Again, welcome everyone. So today's session of our webinar series is on food systems and healthcare, exploring climate action, food emissions, and human health. We are joined today by two inspiring speakers who will be sharing their work in greening healthcare systems, environmental health, and sustainability. So without further ado, I am very pleased to introduce our first speaker, Dr. David Steele. David is a molecular biologist retired from the Faculty of Medicine at the University of British Columbia. He has also held faculty positions at Cornell and Queen's Universities. Dr. Steele is the science advisor for the Plant-Based Cities Movement and also the president of Earthsave Canada. He's a frequent public speaker and contributes regularly to publications with the Plant-Based Cities Movement and Earthsave Canada. He's also an occasional contributor to various other publications. Dr. Steele, please take it away. Share your screen if you like.
Actually, Holly has a prelude too, so we'll let Holly do the prelude.
Okay. Oh, wonderful.
Okay.
Okay, so I'll share my screen now. Just one second here. Okay. Thank you. And thank you for the opportunity to be a part of this webinar series. It's great to be with so many nurses who care about our planet and our environment. My name is Holly, and I'm a NICU nurse in Calgary. I'm concerned about our planet's health for many reasons, but I often think of the little patients that I care for. I know that if we don't make changes now, then climate change will be far worse for the next generation. Joining me is Dr. David Steele, As you just heard, Dr. Steele is a molecular biologist retired from the Faculty of Medicine at the University of British Columbia. He's also held faculty positions at Cornell and Queen's Universities. And we're both volunteers with a grassroots environmental group called the Plant-Based Cities Movement. The Plant-Based Cities Movement is a registered Canadian charity that's combining education and advocacy to help reduce greenhouse gas emissions, protect biodiversity, and promote healthier communities. Our municipal, university, and institutional initiatives are putting plant-based food on the public agenda and making climate-friendly dining the easy and appealing choice. David is also the president of Earthsave Canada. A registered charity since 1992, Earthsave Canada works to change the world by promoting the widespread adoption of plant-based diets. Earthsave Canada uses evidence-based education to increase awareness of the ways in which choosing a plant-based diet will lead to a healthier, kinder, and more sustainable world. We all enjoy our favorite foods, so we know that food is more than just nutrients. Beyond sustenance and nutrition, food is a cultural celebration that honors social and community connection. Traditional dishes and recipes act as a link to our heritage, and sharing food that's personal to us promotes understanding and appreciation. Through food, we celebrate our roots, we care for each other, and we enhance our well-being. But there is no human activity that has had a larger impact on our planet than our food system. Only in recent years has food been recognized as an essential aspect of climate change. Understanding how our food system affects our natural world will help us find solutions and advocate for policy changes. Throughout this presentation, there is no judgment, and we aren't asking anyone to change their diet. We understand that food is a complex issue. We want to hear your thoughts and your questions, but please wait until the end of the presentation or put your questions in the chat. Okay, so David will speak first, and David's presentation will discuss recent ecological reports, global warming, biodiversity loss, pollution, and what we can do about it. And after David's presentation, I have a short presentation on greenhouse gas emissions in healthcare. I'll also discuss planetary health from a nursing perspective, the Eat-Lancet Commission's report, the global burden of disease study, dietary risks, and what we can do about it. Okay, David, I'll give it to you.
Thanks, Holly. So, if you may or may not be aware, for the last several months, multiple major reports have come out about the dire state of our planet, both from climate, biodiversity, just general sustainability. I'm going to key in on two of them today, but they all say fundamentally the same thing. Next slide, please. First will be the Planetary Health Check, which came out last fall. Comes out every year from very high-level scientists, Oxford, other universities, assess our climate, our current situation in our planet, and give their assessment. And as they note in the current one, we have now exceeded 7 of the 9 planetary boundaries beyond which we may or may not be able to sustain ourselves. So we're now at great risk of collapse. Matter of fact, just became to light early this week. The British government produced a study last year that they buried that said British food system could collapse shockingly as early as 2030. It's really shocking how what a precarious position we're in. It's not likely to collapse then, but by 2050, the risk is actually very high unless we change our ways. Next slide, please. The Planetary Health Check identified these 7 boundaries that were overrun as all overrun, and most of them are due to our food supply, or at least largely related to our food supply. Next slide, please. And the Lancet Commission also found the same thing and noted that food drives the 5 planetary boundary transgressions, including land system change, destroying forests, etc., to raise soy, cows, etc., to feed ourselves. Biosphere integrity, again, severe damage to the forest, etc., related to land system change, fresh water change, pollution from nitrates, etc., geochemical flows, again, nitrates, etc., polluting the planet, ammonia getting in the atmosphere, etc. And approximately 30% of greenhouse gas emissions come from our food sources. Even worse, if you look at methane it's largely because of methane. If you look over methane over its actual lifetime in the atmosphere, it's worse than that. We can well estimate that if we look at the actual effect of methane here and now, even food is probably close to 40% of our global warming problem, and that instantaneous point of view, and animal agriculture is actually responsible for roughly a third of our global warming instantaneously. So as the Atlantic Commission notes, food system transformation is essential to solve the climate, biodiversity, and health crises as well. Next slide, please. So the Atlantic Commission, as a way to mitigate the problem, calls for the adoption of a planetary health diet, which is rich in whole grains, fruits, vegetables, nuts, and legumes, and very low in meat, fish, and dairy. In fact, for North America, we'd have to cut our emissions, we'd have to cut our meat and other animal product consumption by about 80%, according to Lancet, and in other studies, I'll bring that up again in another study, in order to just meet net zero goals, even if we slashed all over fossil fuels. Next slide, please. So the real reason is animal agriculture is incredibly inefficient, as I'll emphasize again later. The vast majority of biodiversity loss is due to agriculture, and as this report from a few years ago, which is the UN and Chatham House, pointed out, animal agriculture is the prime driver of this destruction. We only gain about 18% of our global calories from animal products, yet we use 80% of our agricultural land to raise and feed farmed animals. Next slide, please. Why is this so? As I just mentioned, animal ag is extremely inefficient. Next slide, please. This is a simplified table from one of Vaclav Smil's giant tomes on our effects on the environment. And it's basically assessing how well we convert food we feed to farmed animals into food we eat. I'm not going to look at the table so much, but I'll go to the next slide and I'll summarize what it really says. So when we eat farmed animals, we're actually throwing away enormous amounts of protein and calories that we fed them. Calories are even worse, but I'm not focusing on that. When we drink milk, we're throwing away 60% of the protein we fed the cows. Most of that protein went either building the cow up or mostly into waste. For chicken, again, mostly into bodily waste. We lose 70% of the protein we fed them. For pork, it's 87%. And for beef, it's a whopping 95% of the protein we fed from corn and soy and alfalfa, etc., to those cows is lost. We do a whole lot better just growing plants for ourselves to eat. And we'd be doing the planet a huge favor. Next slide, please. These are industry numbers. So we can't get them from government. So Canada's government's very bad at giving us this kind of information. Although there's a group in the University of Toronto who's now creating it, doing a great job on that. There's some great publications out of that soon. But anyway, the industry tells us, even if the government won't, that 80% of the barley we grow in Canada is actually fed to farmed animals. 60% of the corn available in Canada goes to farmed animals. And even 30% of our wheat goes to farmed animals. And this is the industry themselves telling us what they're doing. Next slide, please. You can really see it here. I can't get these numbers for Canada that don't seem to be available, but as Holly's pointing out there with the arrow, that little green bit is the area in acreage that's used for growing fruits, vegetables, nuts for direct human consumption. The rest of it, it's only, again, about 2% of the land used in the United States, and Canada's going to be similar, is used to grow food, fruits, vegetables, and nuts. We eat some of the commodity crops, cereal grains, we eat some of them. As you know, animals eat most of them. Same with oil seeds. We eat some of them, animals eat most of them, cotton, etc. And cotton, beware, but most of the crops we grow don't go to humans at all. They go to farmed animals. Next slide, please. And this really makes it really clear. You look at this chart from Our World in Data. The brownish red is North America, South America. That's the proportion of all the land on the earth that's used to raise and feed farmed animals. For what's used to feed humans directly, the size of China, basically, over in the purple. It's where 7% of all the land in the world is used to grow food directly for consumption by humans. It's a shocking difference. The animal ag is unbelievably inefficient and unbelievably damaging. Next slide, please. And even more shocking is what we look at the biomass on this earth nowadays. There's 3 studies that have come out over the last 20 years, 2 in the last few years, that all come up with the same fundamental result, which is this one. If you look at the weight of all the mammals on the earth, we're mammals, so are cows, so are pigs, so are koalas and kangaroos for that matter. all the mammals on the earth, only 4% by weight are wild nowadays. The rest is us and farmed animals. The great majority of mammalian biomass on this planet is farmed animals and us. And even on chickens and turkeys and the like, they make the bulk of the bird biomass. 70% of all the weight of all the birds in the world are farmed birds, living usually under horrible conditions. Only 30% are wild. Next slide, please. Moving on to global warming, beyond that huge effect on land use, biodiversity, etc., we're also massively affecting our climate by what we eat. Next slide, please. I just picked this quote because it's quite direct, but there's many studies that show the same fundamental thing. The food system is responsible for more than a quarter of all greenhouse gas emissions. More than that, depending how you count methane, of which up to 80% are associated with livestock production. Thus, the decisions we make and what we eat can have a huge effect on what happens in global warming and beyond. Next slide, please. I know you can't see the words. It's not that important. If you look at the top part, everything from about the middle up is animal products. This is the kilograms of greenhouse gas emissions per kilogram of the product. For beef, we're getting almost 100 kilograms of CO2 equivalent for every kilogram of beef we eat. Only rice is in the big bars at all. It's near the bottom. And that's because when we grow rice, we flood the fields, and that creates methane. The plants rotting below feed bacteria that create methane. That's the only plant-based product that has any significant global warming input in and of itself. Next slide, please. And this is an older slide from my old friend at Cornell, David Pimentel, who was one of the pioneers of this kind of research. And this is the United States data, not world data in this particular case, but it's very comparable. And you note that that almost all the global warming created from animal products and other foods is due to the production of them. The green in these bars is all production, raising the animals, growing the crop. That's how much the emissions that come from that. And beef is on the left, very high, and to the right you see all these plants. And the brown is the proportion of the emissions that come from processing, packaging, and cooking those foods. There's one oddball here, and that's potatoes, which is brown for plants. Everything to the left of potatoes is all animal products. But for plants, very odd. It's all why is it got such a huge processing? That's because in the United States, just like Canada, we eat the majority of our potatoes in the form of potato chips and French fries. Those are highly energy intensive products, and that pushes the processing emissions up way high. Still, it's way lower than, even with processing, it's lower than any of the animal products. But the potatoes themselves, if we weren't processing like that, we eat potatoes, you mash potatoes, the potatoes you boiled or baked, the emissions are way lower, and they'd be far to the right of the chart. Next slide, please. And again, this is another study from, I believe this was 2020, that says the same thing as Eat Lancet and the other studies said recently, that in order to meet net zero emissions goals, even if we slash our fossil fuels to near zero, we have to cut our meat consumption by 79%, roughly 80% in North America to meet those emission goals. Next slide, please. Speaking of Canada, there was a study a few years ago that compared directly Canada's emissions to other countries. Turns out, by the way, and even the latest data shows the same, we in Canada per capita are the worst emitters for contributors to global warming in the world, other than tiny little Gulf countries that are producing oil and have hardly any population. We produce more global warming gases per person than any other country in the entire rich world, in the entire Western world. Next slide, please. This study makes it clear. Look at Canada. We're an outlier. These are all compared to other countries in the world. On all counts, we are higher. Food, we're not entirely higher. Finland and South Africa are competitive with us, but it's still a very high proportion. Canada, we're high on everything. Our food emissions are sky high. Our housing emissions are sky high because we have much bigger houses than average and we're colder than average. That puts our emissions way high. Our transportation, we fly and drive all over the place. We're a rich country that buys incredible amounts of new things that also creates emissions. It all adds up to a terrible. We are. This is all just consumption based. Our total emissions are much higher than this, even because there's a lot. It's not consumption, but our emissions are sky high, and food is a huge part of it. Next slide, please. And actually, this study authors note this. They note the Canada's emissions, of course, surpass those of all of the countries in almost every category. And they also note directly and state it explicitly that meat is an emissions hotspot here, responsible for nearly 1.4 tons of global emissions per person in Canada. And they conclude that adopting a vegan diet is second only to going car-free for Canadians to reduce their personal carbon footprints. Next slide, please. But there's hope. It all sounds terrible, but we can easily turn it around if we behave ourselves. Next slide, please. There's multiple recent studies, but I like these two particularly because they really quantify what we can do. This was published in Nature a few years ago, and they looked and see what would happen if we could return some of our agricultural land to the wild, let the forests regrow, the grasslands regrow, and take up carbon and allow biodiversity to recover. And they noted that if we just rewilded 15% of the agricultural land in the world right now, we could remove 30% of the CO2 that's been emitted since the beginning of the Industrial Revolution over 150 years ago. That's fantastic. It would take a few decades, but it'd all be gone. That's 30%. And we prevent 60% of the extinctions we now expect to occur. And if we could restore just 30% of agricultural land, which is a lot, but it's doable, as you'll soon see, we could sequester fully half of all the carbon we poured in the atmosphere over the last 150 years and rescue another 10% of the species now expected to go extinct. And as the next study shows, next slide, please, it's very doable. We don't even have to do all that much. The most effective way we could accomplish this is to change what we humans eat. If people in general adopted plant-based diets, we'd have by far the most effective. We'd be incredibly effective. We'd allow the rewilding of, if we were to collectively go entirely plant-based, we could rewild 75% of the world. 75, well, basically 75%. Several studies have shown that. If we're eating animal products generally, except in very small areas where they have no choice, we could rewild almost basically three-quarters of the land we're currently farming. And of course, we need to rewild to accomplish what those guys said was 30%. So it's really doable. Moving towards plant-based diets is a really smart idea. It's good for the environment. It's good for global warming. It cuts it down. It allows animals to recover. It pulls carbon out of the atmosphere. It's just a wonderful thing. Next slide, please. And just to show you how incredibly important food is, Toronto did a community-wide consumption analysis back in 2019, and they determined that of all these categories, food, transportation, services, housing, and goods, for the personal effects of people in Toronto, the biggest contribution they make to global warming is through their food. And that's mostly because of the meat they're eating. Next slide, please. And just to close, as the chief author of the Planetary Health Check in 2025 noted, even though the diagnosis is dire, there's still a chance to cure ourselves. Failure is not inevitable. Failure is a choice. It's a choice we can avoid, and we must avoid it. Thank you very much. I believe that's it. Next slide, please.
Thank you, David. Thank you, David. I'll talk to you now about the intersection of human health and planetary health and the value of including food emissions in climate action plans. There's a sense that this crisis is stemming from industrial emissions and extractive industries, but healthcare is also contributing to the climate crisis. There's a lot of consumption and use of polluting products in healthcare that we can't avoid. Healthcare workers care about their patients. Healthcare workers cannot care about their patients without considering the environment and the world we live in. But as our patients' needs become more complex, there's a higher demand for energy-intensive care. We nurses see that healthcare is changing. Patients have more complex health issues. We see more daily crises. There's less supports for patients, and there seems to be an ongoing lack of resources in healthcare, making it harder to do our jobs. Those of us working to provide care for our patients care more about than just what we see day to day. Of this 4.6%, about 80% are Scope 3 emissions. Scope 3 emissions are not direct emissions like Scope 1 and 2. Scope 3 emissions stem from the supply chain, and food emissions are part of Scope 3 emissions. There will always be emissions as part of providing care to Canadians, but we should be looking to reduce these emissions to the extent that we can. In healthcare, we aim to do as little harm as possible, and that should include the planet as well. The health sector purchases a lot of food. Reducing emissions is hard, but purchasing less meat and dairy can be easy, especially if we replace meat and dairy with healthy, more sustainable alternatives that can potentially promote healthier eating in our society. The complex issue of our planet's health is grounded in an evolving awareness that all of Earth's natural systems are significant and interconnected. As David explained, the health of all life on our planet is threatened by global warming, biodiversity loss, pollution, water stress, and resource overconsumption. Understanding the biosphere's needs and the well-being of all life systems on our planet requires planetary health consideration. I believe that nurses are prepared to do that because we're trained problem solvers and we're fundamentally required to be critical thinkers. We understand that the health of Earth's natural systems is fundamental to public health, and we're continued to promoting and safeguarding public health. Many scientific reports and organizations have shown that we cannot meet the 1.5-degree limit that was agreed upon in the Paris Agreement if we don't shift our diets away from animal-based foods. One such organization is the EAT-Lancet Commission on Food, Planet, and Health. The EAT-Lancet Commission is a group of 37 world-leading scientists from 16 countries from various scientific disciplines. The goal of the commission was to reach a scientific consensus by defining targets for healthy diets and sustainable food production. The findings of the commission provide the first ever scientific targets for healthy and sustainable food production within planetary boundaries that will allow us to feed up to 10 billion people by the year 2050. The EAT-Lancet Commission's report is an independent, comprehensive assessment of existing science on health and sustainability. It was independently peer-reviewed prior to the publication in the Lancet Medical Journal. And the Commission states very clearly that global decarbonization is necessary. Emissions must be halved by 2030, and net zero carbon emissions achieved by 2050. However, even if all of these goals are achieved, but dietary patterns see no shift, the world will fail to meet the Paris Agreement. You may have heard that the EAT-Lancet Commission issued their 2.0 report last October. The report outlines how we can achieve healthy and sustainable diets for nearly 10 billion people. They chose 10 billion because the global human population is expected to reach approximately 10 billion by the year 2050. What the report says is that the transformation to healthy diets by 2050 will require substantial dietary shifts. The global consumption of fruits, vegetables, and nuts will have to double, and the consumption of foods such as red meat and sugar will have to be reduced by more than 50%. And for Canada, as David noted, we need to cut meat consumption by almost 80%. Now let's talk about the state of human health globally. The Global Burden of Disease Study is the world's most comprehensive, ongoing epidemiological research project led by the Institute for Health Metrics and Evaluation. It measures health loss across the world caused by over 370 diseases, injuries, and risk factors. The study covers 204 countries from 1990 to the present. Cause of death is grouped into 3 large categories: communicable diseases, non-communicable diseases, and injuries. And chronic illness falls into non-communicable diseases. An interesting trend in recent past annual reports is the finding that death from communicable diseases is being pushed out by an increasing number of deaths from chronic disease. The leading cause of death worldwide is broadly classified as cardiovascular disease, but more specifically, the number 1 cause of death today is ischemic heart disease and stroke. As well, the incidence of diabetes has increased globally by over 70% since the year 1990. We know that 75% of all deaths are due to non-communicable diseases, with the top causes being cardiovascular disease, cancers, respiratory diseases, and diabetes. These four categories account for 80% of all premature non-communicable diseases deaths. In Canada, 73% of individuals aged 65 and above have at least one chronic disease. This article, published in The Lancet in 2019, shows that suboptimal diet is an important preventable risk factor for non-communicable diseases. The authors of this study evaluated the consumption of major foods and nutrients across 195 countries to show the impact of diet on global mortality. The study analyzed the cause of deaths globally and found that it's actually suboptimal diet that's responsible for more deaths and disability than any other risk factor globally, including tobacco. The analysis shows that in 2017, 11 million deaths and 250 million disability adjusted life years were attributed to dietary risk factors. Cardiovascular disease and cancers were the leading cause of diet-related deaths. These are also our top two causes of death in Canada. The data showed that by improving diet, we could potentially prevent 1 in 5 deaths globally. And when they looked at the top dietary risk factors, they found that it was too high an intake of sodium and too low an intake of whole grains, fruits, nuts, seeds, and vegetables. This shows that the foods that protect us are also the foods that we're not eating enough of. And let's take a look at what Canada's Food Guide recommends. As you can see here, half the plate is fruits and vegetables. The bottom right corner of the plate is whole grain foods. The top right corner of the plate is protein foods. And the Food Guide states to choose protein foods that come from plants more often. Also, the glass of milk that was part of the previous Food Guide has been removed and replaced with a glass of water. And this is the Planetary Health Diet, which was created by the authors of the Eat Lancet Commission's report, which I spoke about earlier. The Planetary Health Diet is a global reference diet that is symbolically represented by half a plate of fruits and vegetables, just like the Canada Food Guide. This plate represents a diet that would be beneficial to human health and sustainable and beneficial to planetary health as well. The other half of the plate consists of primarily whole grains, plant proteins like beans, lentils, pulses, nuts, unsaturated plant oils, modest amounts of meat and dairy, and some added sugars and starchy vegetables. The report includes animal protein, mostly to accommodate people in areas where food security is problematic, and animal protein helps ensure adequate protein intake. In wealthy societies like ours, that need is not there. We can obtain all the protein we need from non-animal sources. This graphic was also created by the Eat Lancet Commission's report. The graph represents a snapshot of foods we consume here in North America. Within the circle is considered sustainable, and consumption of food beyond the limits of the circle is considered outside of the sustainable boundary. So you can see there's an orange dotted line that forms a circle. Everything that we eat inside of that circle is sustainable, and our consumption of food that encroaches outside the boundary of that circle is considered unsustainable. So let's take a look. Red is beef, gray is eggs, yellow is poultry, and all of these are far outside the circle, showing that our consumption of meat, dairy, and eggs is unsustainable. In fact, we're overconsuming beef by 638%. Inside the circle is green and pinks, which are seeds, nuts, and legumes, all of which are drastically underconsumed in North America. In order to have a more sustainable North American diet, we need to increase our consumption of seeds, nuts, and legumes, and decrease our consumption of dairy, eggs, and animal protein. This information from the Eat Lancet Commission's report is similar information to the Health Effects of Dietary Risk study and similar to the information within Canada's Food Guide and the Planetary Health Diet. I'm just going to take a moment to talk about this position statement. The Dietitians of Canada and the American Dietetics Association have stated that appropriately planned vegan and vegetarian diets can be healthy, nutritionally adequate, and appropriate for all stages of human development. They state that such diets can provide health benefits, including lower rates of obesity, lower rates of heart disease, and lower rates of type 2 diabetes, although they require planning for nutrients like B12 and iron. There is some work being done to reduce food emissions already. Cool Food, all one word, Cool Food, is an organization working to reduce food emissions and to incorporate these emissions into climate action plans. Cool Food is working globally to help organizations reduce their climate impact of the food by shifting towards more plant-rich diets. Cool Food equips food service organizations with the tools needed to shift diets at scale in order to cut food-related emissions. Cool Food uses the World Resources Institute's research to provide data analysis, effective operational recommendations, and scientific strategies to reduce greenhouse gas emissions within an organization. And there's work being done to reduce food emissions in our Canadian healthcare system. Nourish Leadership is a Canadian registered nonprofit and registered charity. Nourish sees food at the heart of healthcare and aims to transform food in the Canadian health sector by fostering sustainable and culturally appropriate food services that improve patient and planetary well-being. Nourish works to empower the health sector to shift food away from a cost-driven service to a core component of healing and planetary health. Nourish's work to influence healthcare policies that provide sustainable, local, and nutritious food procurement is slowly transforming food service in the Canadian healthcare sector. Nourish believes that healthcare food providers can make bold changes to improve the health of their patients, community, and the planet. Through reduced food waste, the adoption of plant-forward menus, and climate-friendly ingredients, as well as values-based procurement, Nourish is presenting straightforward and delicious solutions for healthcare providers to improve patient and planetary health. In 2023, Nourish published an important guide that introduced the concept of incorporating values into food purchases for hospitals. This implementation guide provides tangible practices for Canadian hospitals to shift away from existing models to values-based procurement, which incorporate values of health and sustainability into existing procurement budgets. Food purchased within the Canadian healthcare system contributes greatly to food supply chains. This implementation guide outlines a path for value to be added to the supply chains that could work to create a more resilient and sustainable supply chain for Canadian healthcare and for the Canadian food system as well. Cool Food and Nourish also work together. Cool Food knows that working to significantly reduce our emissions means addressing what's on our plates. Cool Food provides a framework to assist food providers to reduce the climate impact of the food they serve without compromising taste or customer experience. Cool Food uses a collaborative model to ask organizations to achieve a 25% reduction in food-related greenhouse gas emissions by 2030. This goal of a 25% reduction is an achievable goal for many organizations, and there are even healthcare organizations in Canada signing up to try to achieve this goal. Through Nourish's community of practice, Nourish supports a growing number of Canadian healthcare organizations to meet their Cool Food Pledge commitment. Nourish provides support and mentorship to assist Canadian healthcare organizations to work towards their goal of reducing food-related greenhouse gas emissions by 25%. And today, there are 38 hospital sites in Canada that have taken the Cool Food Pledge and are working with Nourish to meet their Cool Food Pledge commitment. I'll cite some other examples globally of work that's being done to reduce food emissions in the healthcare sector. New York Health and Hospitals operates 11 hospitals in New York City. In 2022, these 11 hospitals began serving plant-based food as the default food to their inpatients for lunch and dinner. Everyone received a plant-based meal unless they requested otherwise. In other words, those who wanted to have meat, dairy, or eggs for lunch or dinner needed to complete an extra step to avoid receiving the plant-based default meal tray. The choice to consume a meal with animal products still remained, but the patient had to take that extra step in order to opt out of the plant-based default meal. The results were amazing. There was a 36% reduction in food-related carbon emissions. The plant-based meals cost about 59 cents less per tray. Over 90% of patients were satisfied with their meals, and now over 50% of the meals that New York Health and Hospitals serves are plant-based. The New York Health and Hospitals default menu was initiated by internal pressures. Local government, health management, and food service providers wanted to provide patients with healthier, delicious, and more sustainable meal trays. And Greener by Default was ready to help them achieve this goal. Greener by Default is a global nonprofit based in the United States that helps institutions shift their menus towards plant-based defaults in order to reduce emissions, lower food costs, and improve health. The Greener by Default patient meal trays are healthy, culturally appropriate, and comforting. And patients who still want to have a tray with meat, dairy, or eggs are free to do so by taking that one extra step and opting out of the plant-based default program. That step allows patients who want to have a tray with meat and dairy to do so, and that one extra step is key to allowing freedom of choice. Greener by Default has had great success with their work and has worked with organizations all around the world. The New York Health and Hospitals Initiative has been so successful that the program is expanding. Sodexo, a major food service provider, and Greener by Default are partnering to bring plant-based default meals for at least one meal per day to hundreds of more U.S. hospitals. The Sodexo and Greener by Default partnership aims to cut admissions, cut costs, and improve patient health with their expanded scope. There's over 100 hospitals on board right now, with a goal of reaching 400 hospitals later this year. Newfield Health, the UK's largest healthcare charity, has been working with Sodexo and Greener by Default as well. This three-way partnership is working to redesign inpatient meals for 35 of their hospitals. Newfield Health's long-term partnership with Sodexo has had a strong focus on health and sustainability. Newfield and Sodexo were already working to reduce food waste and were trying to cut food emissions. And in 2025, Newfield Health and Sodexo included Greener by Default in their work to increase their plant-forward dining. And these are the results. Newfield Health is now serving the plant-based default menu at least once per day at 35 hospital sites across the UK. This has allowed them to increase their vegan menu options, reduce meat dishes served, and decrease their food-related greenhouse gas emissions by 22%. These are relatively small changes. For example, the vegan menu offerings only increased from 34% to 41%, and the meat served per patient only fell by 14%. But still, they were able to bring down their food-related emissions by 22% in over just a year. This shows the transformative potential that this work can have. And Newfield has a goal of serving 90% plant-based food. By making plant-forward or plant-based trays the default, Newfield is empowering patients to make healthy, sustainable choices while always respecting their freedom to choose. And we have a video to show you that will show you the results of the Newfield initiative. Just one second, let me get that. Sorry.
Nuffield Health has an ambition to get to carbon net.
You need to share your screen, Holly.
Yes, there we go.
You can't mute yourself, Holly, or the video won't play. Don't hear the sound.
We reached out to Sodexo, who then partnered us with Greener by Default. And we set ourselves two metrics: try and reduce the meat-containing dishes on our hospital menus down to just 10%. And secondly, we wanted to reduce our carbon score by 30%.
At Sodexo, our aim, although it may sound quite ambitious, is actually reaching net zero by 2040. I think sustainability and nutrition goes hand in hand. We're trying to make hospital meals more sustainable. I think it's a great idea to have a plant-rich approach. It's really important that we not just care for the patient, but also care for the planet as well at the same time.
One of my biggest concerns with this project was removing patient choice. We didn't want that to happen. When a patient's in hospital, there's very few things they can control, and what they choose off the menu is one of those key things. So we really wanted to make sure that we gave patients a really good choice, and we wanted them to not really realise that we were reducing our carbon score.
There are a number of different techniques that we can apply to the menu, such as looking at the wording of something, removing words like vegan or meatless, and changing it for something that's much more appealing. An example of this might be if you have a dish on your menu and you call it a celiac bowl because it's gluten-free. Chances are only people who are celiac or gluten-free are going to pick that bowl. But if you change the name to be a Thai peanut rice noodle bowl, then so many people are going to pick that dish because it sounds simply delicious. Another technique we can use is menu positioning or prime placement, thinking about where those plant-based dishes are placed on the menu. If they're on a separate menu, then only vegetarians or vegans are going to ask for them. But actually, if they're incorporated within the main menu, then it allows everybody to select from everything on the menu.
This programme is really exciting. Lots of sustainability projects are long-term, whereas this is every 6 months we can see an actual tangible impact on our KPIs and our results.
I've never enjoyed hospital food before, but there was a wide variety of different foods that I think would accommodate a lot of people's dietary requirements and preferences.
The results of this pilot are really promising. We've achieved a 22% reduction in food-related carbon emissions. That's the same as driving more than 100,000 miles, or the equivalent of 4 times round the equator. Meat served per patient was reduced by 14%. And servings of plant-based protein increased by 50%. Our pilot has shown what's possible, so we're not stopping there. Patients are ready for change, and our aim is to get to a 90% plant-based menu, all while maintaining high patient dining experience. It's an exciting time, both for a healthier hospital plate, but also a healthier planet.
Okay, just 1 second here. So as you can see, there is potential for significant food-related emissions reductions with these strategies. And the health sector, just 1 second. And the health sector and the health and environmental co-benefits allow us to promote healthy eating while improving patient health and while addressing the environmental crisis. Serving more plant-forward or plant-based meals can be very cost-effective as well. The health sector has an opportunity to become a leader on sustainability, showing that plant-rich diets are healthier, easy, and have transformative potential to reduce emissions. So thank you for taking time to learn about this today, and now we'll open up the floor.
Wow. Thank you both so much for being here. What an excellent video to end with. Like, it's such a compelling story, and you both did such a beautiful job of really presenting a well-informed and highly relevant to our audience, who I believe are probably, largely healthcare professionals. And it was so carefully constructed. So thank you both for like a beautiful afternoon so far. And we have a little bit more time, so we're going to shuffle on over to a Q&A period with both of you, kind of like a panel. And this is going to be mediated by the lovely Mona Haymore, a professor at McEwan University and one of the co-creators of the webinar series. So at this moment, please feel free to add any outstanding questions to the Q&A section, but I'll pass it over to Mona.
Thank you, Ashley. And thank you, Holly and David. I agree with Ashley. What an inspirational kind of presentation, just bringing such an important topic into real world kind of application, but also looking at it from healthcare systems. So thank you so much for doing that. Yeah, I'm watching the Q&A and hopefully we'll see some questions coming in. But maybe I will start with a question that actually just came out of listening to both of you, sharing all those evidence-based knowledge and research and also applications from practice. I'm curious about, it was mentioned, I think by you, Holly, that 38 hospitals within Canada has adopted this kind of plant-based approach within their system. So I'm wondering, David, you and Holly, what can be done to leverage and extend that kind of practice to make it more sustainable and more Canadian kind of approach to plant-based, service within hospital setting, contributing to the overall target of decreasing our greenhouse gas emission?
Okay, I think I can answer this question. So through the Cool Food Pledge, they use the World Resource Institute's data analysis and they measure food emissions. And measuring food emissions is actually not easy. You have to count all the food that you purchased for a year. So, but by doing that, you can measure your food emissions. And then once you start measuring your food emissions, you can compare to how other hospitals are doing. So if more hospitals would just would just use the World Resource Institute's tools to measure their food emissions, then we could start comparing how we're all doing and work together. And Nourish's community of practice is designed for that specifically. Nourish is such a great organization. They're very committed to helping healthcare organizations in Canada, it's a Canadian nonprofit, count their emissions and work to reduce their food emissions using the Cool Food Pledge. So I think that in healthcare we just need to talk about it more, and that there's just not enough momentum here in Canada. In other countries, UK, United States, there's more momentum going, but we're a little bit behind. But I believe that we're going to catch up, and that Nourish is going to help us, and Cool Food is going to help us, and that we ourselves are empowered and we want to make the changes ourselves. Do you have anything to add, David?
Well, I think you covered it. There's other organizations as well, such as Peach out of McMaster University is working towards this, and can't think of the other one. Rihanna Topan is with an organization I can't think the name of, which Forward Food that designs food and makes it easy for hospitals to adopt very tasty plant-based dishes.
Yes, and Forward Food has an enormous recipe bank that is designed to make these recipes at scale, at cost. So hospitals could use the Forward Food recipe bank to produce large amounts of food that are healthy, nutritious, sustainable, and most likely cost less. They're designed to cost less at scale.
Thank you, Holly and David. Such a great way to look at it by increasing more awareness and more adoption strategies, because it's such a shift in cultural practices here within Canada, where there is lots of orientation towards meat and dairy products than other options. I'm just watching the Q&A, and I think there are two questions. There's a question, I don't see a name aligned with the question, but the question is saying, are you getting enough support from governments? If the situation is going towards a stage where there could be no return, then do you think food choice will no more be a choice but a necessity? So that's the first question.
Okay.
Go ahead, Holly. You want to go first?
Okay, I can begin to answer that. First of all, the Canadian government subsidizes farming in Canada and also pays farmers a large amounts of money when there's disasters, droughts, or any kind of problem. There's payouts to farmers. Our Canadian government is still funding animal agriculture,
Right.
and to a great degree as well. So I think that first we need to transition away from, we need to start funding more sustainable agricultural practices. And a very small amount of agriculture in Canada is actually growing food for ourselves. So maybe David, you can add?
Yeah, I would also add that Plant-Based Cities is reaching out to cities, other levels of government, including the federal government, which has run a couple of pilot programs to make plant-based foods more popular, more accessible, and more forward and obvious in their cafeterias. So there is some motion going on. You can lobby government, you can lobby representatives, you can get involved with plant-based cities. Where we are doing this, we're approaching local city councils. We've gotten several cities to pass motions to move to prioritize plant-based foods, and we're working in other cities at this time where there's we're talking with the federal government, getting some success. So Plant-Based Cities is a great organization to get involved with to help get government to make change.
Yes, we've had motions passed in 6 Canadian municipalities, and there's lots of other work being done through the universities' initiatives, and we're working very hard. We're a small group, and we're working very hard. We're always looking for more volunteers.
And we got a policy change in another municipality, and we're likely to have another one in another major city shortly.
Yeah, unfortunately, this work is not being led by the government. It's being led by grassroots organizations and people who are just really passionate about it.
Thank you both for answering the first question, and we appreciate just sharing that kind of hope towards longer and sustainable change. I have a question from Stacy Nelson. Call for hospital partners transitioning to sustainable food choices in healthcare. It's mentioned here for its 2026 project, the Sustainable Food Systems Committee is launching a quality improvement initiative supporting hospitals across Ontario and piloting plant-forward menu transitions. Participating hospitals will be invited to replace their 5 most frequently ordered meat-based entree items with operationally simple plant-based alternatives for 4 weeks. Through this pilot, sites will contribute data to assess impacts across key domains, including operational feasibility, cost implications, environmental outcomes, and staff experience and perception. We are currently seeking hospital partners interested in participating and collaborating in this initiative. To express interest or learn more about participation requirements, please contact Fiona Barascandalo, and the email is mentioned here. I'm going to put it in the chat. So I think it's more of sharing this kind of shift in practice and examples from Ontario. So I'm wondering, Holly and David, if you have
I'm actually involved in that project. I'm actually involved in that project. It's a brand new project.
Wonderful.
That's Peach, as I mentioned, at McMaster, that we are designing this program to try and get hospitals to change and making it easy and doing a pilot program to get changes brought into a few hospitals in Ontario to start and hopefully spread well beyond that.
Yes, me and David are both volunteers on that committee that's working on that.
Wonderful. Okay. We don't see any more chat unless there is something coming. Okay, right, Stacy. Yes, it was a comment, not a question, but we truly appreciate it. And it's a great, highlights of what's going on also with Holly and David kind of work on the same topic. Maybe just as we're closing, and I will switch it soon to Ashley, I'm just wondering if you want to just maybe share some kind of hopeful message to all our audience whom they are with us here in the room today about consideration for shifting in perception around, plant-based diet and how can be, implemented within their roles. So what kind of hope message you'd like to leave us with?
Okay, well, I work at the NICU in Calgary, and I've shared with my coworkers a bit about the work that I do on a volunteer basis outside of work. And I find them very supportive and open-minded. And I just feel that healthcare providers in general are open-minded people that really do care about more than what we see day to day. And we understand that the care that we provide to our patients is directly connected to planetary health. In fact, planetary health is fundamental to public health, like I said in my presentation. So I find that healthcare workers are super open-minded to this message and are willing to take on initiatives. We just need to present them with the opportunities and create the changes more in our society and in our healthcare system. But I think that the Canadian healthcare system is ready because the nurses and other healthcare workers are also ready to take on the challenge.
Thank you, Holly. And David, any hopeful message for us?
Well, again, one thing we can do, one of the most, as that one study said, the second most effective thing Canadians can do personally to reduce their carbon footprint is to collectively move towards plant-based diets. The more of us that do it, the more the market's affected, the more we reduce global warming.
Indeed. Thank you so much for just, letting us remember that's all doable, as you mentioned in your presentation. And individual participation is truly, truly effective in the whole entire process. Yeah. Thank you both. Ashley, I think it's your turn for the closing remarks.
Yes, thank you again, both. I think probably the key takeaway I personally am taking away today is that there's good work and lots of hard work being done across Canada, but also around the world that we can kind of learn from, and that we're not alone in caring about this. So thank you both for coming here today. As we approach the end of our time together this afternoon, on behalf of the Education and Sustainability Committees, we'd like to thank everyone who came today, and thank these wonderful speakers for generously sharing their time, energy, and insights with us today. I will quickly share this slide so that you have their contact information, because they have generously offered to share their contact information. So you'll see their emails that they've provided to today's attendees if you'd like to reach out in the future with inquiries or collaborations. A reminder that this session will be posted on CANE's website under the What We Do section of the website. Just kind of check out the tabs along the top. And then it'll be placed into the webinars repository. And finally, we want to thank you, our wonderful audience, for joining us today and taking time out of kind of the middle or the later afternoon part of your day, depending on where you're coming from, to talk about and learn more about these exciting and important topics in food systems and healthcare and planetary health. We hope you have a wonderful rest of your day. Return to your daily tasks feeling a little bit rejuvenated, less alone, knowing that you're, you're among friends and doing this really important work. And maybe moving forward with more awareness of some of the wonderful initiatives happening around the world. Hope to see you at our next session, which is tentatively planned for April 23rd. Be well, go forth, and remember that none of us are alone in our pursuit for sustainable and equitable healthcare for everyone. Bye, everyone.
Bye-bye.
And